Hey everyone, it's Dr. Alan Tenosha, Town Center Family Dental in Hillsborough, and we are in the office today and I'm taking questions. We've been getting a lot of phone calls asking us about when we're going to be open. So I'm going to give you some answers to those questions, and I know, Allison, I think you have some of those questions right now, right?
I do. One question that we're getting a lot is, are all dental practices opening now?
So what's happening across the country, there's about, as of today, which is May 13th, I think, there are 28 states now that are fully open. You know, the situation in New Jersey is that offices are open for urgent care and emergency care. Some offices have chosen to remain closed. We are open, and recently we've added some additional availability hours to meet the needs of our community. So every office is different, every town is different, every state is different. We do expect, though, in the early June to be fully operational with regular preventive care and all dental services. So that's a common question. Thanks. What else
Great.
you have?
People also want to know how dentists are adapting to
Okay,
COVID-19.
that's a great question. So there is a lot of communication in among dentists using Facebook, using forums and message groups. Also, the American Dental Association has given us advisories. Some of those we've taken, and then we've added our own things on top of that. What some offices are doing are waiting for more definitive guidelines. We've kind of taken the direction that we're going to do our own research and do our own guidelines that are going to be probably much more stringent than what is going to be released by the Dental Association, the CDC. So we've chosen to do filtration systems, air filtration systems in every treatment room. We've done modifications to our HVAC units. We're just trying to improve the air quality within the facility. And then, of course, pretty much all the offices are moving towards more stringent mask wear, N95s, level 3 surgical masks, disposable gowns is common. You might see face shields when you go back to your dentist. So everyone is doing different things, and I think eventually there will be some type of standard. But as of right now, it's kind of wide open.
Great.
What else you got?
And this is a big one. Will COVID-19 affect dental costs?
Well, there is some talk of that. So some of the insurance companies there have been appeals made by some dentists so that they can pass on some of the costs for the PPE. That's what you hear all the time, the personal protective equipment. I have read that there are some insurance companies that are going to be covering about $10 per visit. We've chosen here not to pass on any of those costs, so we're just going to absorb them ourselves. But it will not be unusual if, when you return back to your dentist, if you see a separate line item for a PPE charge. And what I'm hearing, about $10 per visit.
Great. And this last one we're getting a lot, is it safe to get my teeth cleaned?
Okay, is it safe to get your teeth cleaned? So, from what we know, there's been no transmission of disease in any type of dental setting. There's been no known transmission of the coronavirus to a patient from a doctor or a hygienist or anyone like that. So there's no reason to think that it's not safe. However, there are a lot of precautions that are being made in dental practices all throughout the country in terms of upping the standards of cleanliness, both disinfecting the hard surface areas, that's the countertops, the dental chair, any exposed equipment, and also the air. So some offices have chosen to address air quality and to improve that. And so we're doing both of those things, and many offices will be doing that. So I can't speak for every office and every location. I know here, feel very confident. Our own families are coming in now. We're now starting the process of bringing patients back. For the rest of the month, we expect to see hygiene patients, in other words, patients seeing the dental hygienist, that are probably what we call high risk. So these are people that have periodontal disease, or they may have medical conditions, or they're elderly, or they're immunocompromised. These are people that are coming in, what I would say, for the next 2 weeks. We do expect full opening in early June, and at that time, pretty much anyone should be able to make an appointment for a cleaning. Is that it?
That's it.
That wasn't too bad. I hope I answered some of your questions out there. And as always, we're available by text or phone. It's 908-874-4555. I know there's a lot of confusion and a lot of misinformation out there, and it's our goal just to give you as much of the good information that we can give you and share with you everything we know so that you can begin to get on with your life and have a normal life again. Okay? See you guys.